Good afternoon, everybody. Thank you for joining. We're just going to give it another minute or two as we allow people to join the webinar. I appreciate you being with us this afternoon. All right, so we're going to get started. So again, thank you for being here this afternoon. Today we have another informative webinar from DefibTech, and we have a very important topic. And today we're just talking about overall about sudden cardiac arrest, what it is, statistics, and we're going to kind of learn about a really amazing organization that's doing work every day to try to prevent people of all ages from dying from sudden cardiac arrest. Before we get started, just a couple quick housekeeping things I just want to talk about. If you have any questions as we go, if you go to the bottom of your screen, for some people it might be at the top of your screen, you can click the Q&A and enter a question. At the end of the webinar, we will get to as many of those questions as we can. Another thing to note is once this webinar concludes, we will be recording it and uploading it to our YouTube page. So if you know somebody that missed it, that might be interested, you can certainly refer them back to our YouTube page. So my name is Mike Papale. I am the Manager of Community Relations here at DefibTech. And today I am joined by Mary Newman, who is the co-founder, president, and CEO of the Sudden Cardiac Arrest Foundation. Additionally, she was just recognized in 2021 by the American Heart Association as the Resuscitation Champion of the Year. So before we start talking about sudden cardiac arrest, I just want to briefly talk about DefibTech, who we are and what we do. So DefibTech is a leader and innovator in the design and manufacture of life-saving resuscitation devices. Our medical technology provides easy-to-use resuscitation equipment. Public safety, healthcare providers, and bystanders depend on our products every single day. We are owned by an international medical device manufacturer, Newman. And we are committed to designing and creating products that help communities around the world respond to sudden cardiac arrest. One thing that we're very proud of at DefibTech is our mission. And ultimately, our mission is to help save lives from sudden cardiac arrest. Our vision at DefibTech is to lead explosive growth in the AED usage and transform the pre-hospital treatment of sudden cardiac arrest. We take our mission very seriously. You know, we have a lot of employees that are very passionate about what we do and can see firsthand the impact that they're having. And one of the things that we're, is a really big part of what we do is positioning ourselves and partnering with key stakeholders throughout the country and throughout the world that are doing things similar to what we're doing and have a similar mission. And one of those important partnerships is with the Sudden Cardiac Arrest Foundation. So now I am going to officially kick it over to Mary Newman so she can talk about Sudden Cardiac Arrest Foundation and all the amazing work that they're doing.
First of all, I'd like to thank you, Mike, for that very nice introduction, and also thank DefibTech for being one of our partners. It's really great working with you. We really enjoy interacting with you and with DefibTech. So thank you for that nice introduction. Our organization, the Sudden Cardiac Arrest Foundation, is actually based in Pennsylvania, but I am now working from Montana, which is not a bad place to be. This is a picture from Glacier National Park last summer. So I had the honor to meet Mike and his mom a long time ago. And so I guess that was in 2015 that we worked on that, facilitating getting the PBS program going on your description of your sudden cardiac arrest. And I had the honor of meeting Bob, who was your rescuer. I don't know if you want to comment about that, Mike.
Oh, I'm sorry, Mary. I didn't hear what you said. Yeah. So, you know, I survived sudden cardiac arrest in 2006, and I was 17 years old, and my my mom, of course, had no clue what sudden cardiac arrest was, which I know is something that you're going to talk about, helping people better understand it. But of course, in her Google search, she came across you and, the work that the Sudden Cardiac Arrest Foundation does. So, that was a huge starting point for me as a survivor to kind of learn about sudden cardiac arrest, who it affects, and how people can be saved. And we certainly appreciated you giving us the opportunity to fly out and be a part of a TV show on PBS. It was a great opportunity, and obviously it was a great way to spread awareness about, not my story, but there's certainly a lot of other people that have very similar ones.
Yeah, that was great, and I guess it's maybe kicked off your journey and what you're doing now in the field. So
definitely.
So I'll talk first a little bit about the Sudden Cardiac Arrest Foundation, and then I'll be talking about sudden cardiac arrest in general. The Sudden Cardiac Arrest Foundation is a nonprofit organization that was founded in 2005. And we are considered by many people to be a go-to source for reliable, trustworthy information and resources. We have a team composed of nationally recognized leaders in the field. And I would say awareness, education, and ultimately neurologically intact survival is our passion. To find out more about SCAF, you can go to our website, which is sca-aware.org. But I'll continue on the next slide. Our vision is to eliminate preventable death and disability from sudden cardiac arrest and support people who are personally affected by SCA. Our mission is to raise awareness of sudden cardiac arrest and promote initiatives that help save lives through our three key pillars: education, research, and community. Our values are integrity, respect, collaboration, support, and celebration. This graphic describes what our strategic priorities are. We provide information through our website, through newsletters, through social media, and have quite a following actually on the website, a lot of traffic there. We work on educational campaigns such as the Call Push Shock campaign, which is a public-facing collaboration to drive awareness. We also work on research, both consumer and medical. The consumer research that we've conducted has been in collaboration with Stradiverve, and through that research, we found out about the lack of awareness of sudden cardiac arrest, which probably doesn't come as a surprise to many of the people out there. And so that's been really interesting to see how much farther we have to go to educate the public. We've also been doing medical research, working in collaboration with universities and academic hospitals on post-cardiac arrest survivorship. So that's a growing area. We've worked with Columbia, Harvard, University of Colorado, and a number of other researchers. In terms of survivorship, we're about to launch a national community to support recovery. Now, we've had an online survivor network since the very beginning, but this is going to be a new and improved version of that. And we're excited to get that launched in early 2023. Also, we have several chapters. We have a chapter in Oregon and one in Southern California. And there seems to be some interest from other people to form regional chapters. I mentioned the Call Push Shock campaign. That is a national collaborative movement that was co-sponsored by Parent Heart Watch and Sudden Cardiac Arrest Foundation. It's designed to drive public awareness, understanding, and action in cases of out-of-hospital cardiac arrest and increase survival rates by speaking in one voice across multiple organizations. It urges the public, when it witnesses sudden cardiac arrest, to call 911, provide CPR, and use an automated external defibrillator. We have 50 plus co-partners, including DefibTech and the CDC, actually. So it's nice that we're all working together on the same cause. And now I'm going to talk a little bit about sudden cardiac arrest in general. As many people on this webinar probably know, out-of-hospital cardiac arrest is a national killer. It's a major public health crisis affecting about 356,000 people a year in the US. Survival rates have languished for years at about 10%. And if you want to envision what that looks like, imagine 2 jet planes crashing every single day and killing nearly everyone on board. It's interesting to note that survival rates in other countries are as high as 20%. So there is a need for improved public awareness and understanding of sudden cardiac arrest. We conducted research in 2015 and 2017 to find out to what extent the public is aware of cardiac arrest. And it, sadly enough, in the both research surveys, when people were asked the open-ended question, what is the single most important medical or health concern for you or somebody in your family? Not a single person said sudden cardiac arrest. So generally speaking, people do not understand the importance of immediate bystander action. And it's very frustrating, I think, for a lot of people affected by cardiac arrest that people do not understand the difference between SCA and heart attack. And as you can see from this graphic, the difference is, the heart attack victim is responsive, is breathing, their heart is beating, and they don't need CPR or an AED, in contrast with the SCA victim who is unresponsive, not breathing normally, their heart has stopped, and they need CPR and AED. This graphic shows that when bystanders give hands-only CPR, survival rates increase to about 30%. And if bystanders have access to AEDs and use them before EMS arrives, then the survival rates are about 50%. So it's quite a big difference, and it just really shows the critical importance of bystander action. This is a quote from Mitchell Brown, who was the former director of public safety, that I think is very poignant. He said, even if EMS arrives at the scene within an average of 7 minutes, in most cases, the victim's fate is determined before the paramedic arrives. It's also important to note that most out-of-hospital cardiac arrests occur in the home. So it's important for the public to understand that, the person that they may end up saving is actually somebody that they know and love. It's not necessarily, the chances are more likely it'll be someone they're familiar with than it will be a stranger. So that should be something that motivates people to learn CPR and learn how to use an AED, and ideally have an AED at home or in your vehicle, because that could make all the difference. I personally have one in my vehicle, which is in my garage, in my home right now. So anyway, I'd like to thank you again, Mike and Defib Tech, for giving us this opportunity to participate in the webinar, and just to restate that we really appreciate working with you.
Cool. I just have just a couple questions, and again, if you have questions, you can put them into the chat. But I just wanted to talk quickly about the network that you said is launching of survivors, and kind of goes hand in hand with the American Heart Association and how they recently added the 6th link in the chain of survival, being recovery. And if you could just talk towards like the importance of that network and what the goal of it is going to be to try to provide resources to cardiac arrest survivors.
Well, we're hoping to make this just an indispensable source, a destination for survivors, for family members, for friends who have all been affected by cardiac arrest, to come together in one community, one online community. It's going to be awesome. I'm really excited about it. But we're working with leading cardiologists around the country, working with a lot of other organizations that also have survivor communities. And we're going to be trying to bring everybody together in one place. And there we will provide not only the ability for people to easily interact with each other, but also we'll be providing resources. We'll have webinars related to post cardiac arrest survivorship. And, we're starting to realize more and more with the research that we've been doing with various universities and hospitals that there's such an unmet need for patients and families after cardiac arrest. And quite often, probably more often than not, people don't receive any guidance. They just get a slap on the back and, hey, have a good life, hope all goes well. And there are a lot of issues that people face related to not only physical recovery, but also psychosocial recovery, emotional recovery. There's a lot to it, as you know, Mike.
Yeah.
So we're trying to kind of be a one-stop shop for survivors to get information.
Yeah. I just want to talk to that really quickly as a survivor and the importance of it. So, I think it's really amazing. And I think it's a huge piece that I think it's starting to get talked about more. But I think it's something that's, again, not talked about enough because we, as someone that survived sudden cardiac arrest, as we know, the population and the numbers are low. But when someone does survive and they leave the hospital, I believe now that it's been 16 years since my cardiac arrest, that you can get back to living, a very normal life as a survivor, as a heart disease patient. And of course, there's limitations and changes that might need to be made. But I think one of the things I struggled with early on was kind of figuring that out. And I was 17 and it was really important for me to still be active and I was going off to college and there was like a whole lot of things going on that, I think we had resources like yourself and the Southern Cardiac Arrest Foundation, among others. And just having that opportunity for new survivors or old survivors to even be able to connect to other people that have gone through something similar, I think is just, it's invaluable. And I think it's a really important thing for people to have. So,
and I think, Mike, you'll be an inspiration, I think, to a lot of people in that community because you have, gone on and you're doing great things and, life is good. So
definitely.
That's, for some people, it's good to know that people have come through like you have.
Definitely. Just another question that I have actually is what, obviously there's so many people out there that are doing work every day trying to make the numbers get better, right? Get that survival rate to be higher. And what do you think? What are some of the things, the big things that you've seen since you started this organization that have been, I guess, wins and helping that survivor rate grow? That makes sense. Yeah, I guess so what are some of your biggest wins with the organization since you started?
Well, I think awareness is slowly growing. I think the frequency with which bystanders intervene with CPR and AEDs has increased slightly over time, not as much as we'd like it to be, but at least that's making a difference. And I think that the more survivors we have to talk about their conditions, et cetera, the more the awareness will grow. But honestly, I was involved with one of the early citizen CPR conferences way back when, and we wanted to have a few survivors to come and talk at the conference. And it took forever to find 3 survivors. And now, when they had Citizen CPR had one of their recent meetings, they had over 50 survivors. And when I was previously at the National Center for Early Defibrillation at the University of Pittsburgh, we had a number of national meetings with survivors. And I think the more survivors can get out in their communities to help raise awareness is going to make a difference too. I don't know if that answered your question.
Yeah, definitely. I think that's a perfect way to express it. Like, all those years ago, it was hard to find people that survived sudden cardiac arrest. And now, even for myself, I feel like I do hear about it more often than, I did when I first started doing this. So a couple other questions that came through. So first one was, can the slide deck be shared to those of us here? And the answer to that is yes, we will. Once the webinar ends, like I said, we're going to get this up on YouTube, and we will send out an email to everyone who registered, and we can attach a slide deck so people have it. Another question that came through was, are there any resources for discounts to community members who want to have an AED available either in their home or available for folks in their neighborhood? That is a great question. It's definitely something that we could potentially help with at the FibTech. I would say the best thing to do for that would be to reach out to me here at the FibTech, and my email is mpapale@thefibtech.com. And we can certainly help. We've worked with some groups that have done exactly that. They've worked on getting AEDs in neighborhoods, which is a really cool concept. And it's almost something where if you can get people from the neighborhood to pitch into it, you can get an AED that can be accessible 24 hours a day, and a really, really great outdoor cabinet. I think, Mary, this is a question for you. What is the timing of the network initiative? I guess when is it going to launch, do you think?
Early 2023. We're going to be talking about it at the upcoming Resuscitation Science Symposium in Chicago next week. We'll be describing it, and we'll have, at that point, we'll have a website just for that program, but we won't actually launch the interactive community till early 2023.
Okay, cool. And I think this is one we actually both can talk about a little bit, but the question was, is genetic testing suggested for survivors? I don't know if you want to start, and I can kind of talk about my experience with genetic testing.
Yeah, you should start.
Okay. So the answer to the question is yes. So the thing about genetic testing is it's come a long way. And, for my family, and just going to kind of speak on my personal experience, I first was diagnosed with hypertrophic cardiomyopathy, which is known to be a genetic condition. So right away, my doctors wanted to test both my parents to determine which one of them passed the disease on to me. So we found out, and my dad was 45 years old at the time, and he was diagnosed with hypertrophic cardiomyopathy after I was, and it has never affected him a day in his life. He played 2 sports in college. He's never had a symptom. And it was just, again, a huge learning curve for my family and me. I also have a younger brother who was 13 at the time of my sudden cardiac arrest. And because of him, my doctors all suggested that I get genetic testing. And it starts with me, the person who, has the HCM. And unfortunately, when they tried to determine the gene that causes my HCM, they were not able to do that. And therefore, they were not able to test my brother for it. So I am not an expert in genetic testing, but I will say that typically what happens is they isolate that gene. Once they have it, they test other family members for it. And in my personal situation, they were not able to do that. So therefore, my brother had to get an annual electrocardiogram, annual echocardiogram. And thankfully, he's, to this day, has never been diagnosed with the disease. And he was able to get through college and play basketball. And, they think that it would have developed and started showing the excessive thickening of the heart during, his late teenage years, if it was going to. So, but for precaution, he does get tested every year still. So I don't know if you have anything you want to add to that.
Well, I don't know a lot about it myself, honestly, but I know enough to advise people when they ask, do you think other family members should be tested? And we always say yes. Want to make sure the other family members are okay.
Cool. Yeah. This is great. So we've had some questions, more questions coming through. So one was, do you think that the community should be inclusive of lay rescuers? So I'm not sure I quite understand the question, but I'm going to answer it based on kind of how I'm interpreting it. So yes, I think lay rescues are crucial to survival. You know, if you talk to, and I'm not an EMS professional, I've done a lot of CPR and AED training, and we obviously are spreading a lot of awareness there at the FibTech of the importance of bystander CPR and AED usage. So yes, it's crucial for bystanders to be confident to step up, you know, and number one, witness sudden cardiac arrest and then immediately act. You know, if you would talk to an EMS professional, I would imagine that they feel really good arriving to a scene that is a cardiac arrest and they see CPR started, they see an AED deployed. They know that the survival rates from there are really high because those first three links in the chain of survival have been fulfilled. You know, the first three links in the chain of survival all occur before an ambulance even gets to the scene. And, you know, we see direct correlation between, you know, CPR and AED used by a bystander before the ambulance arrives to higher survival rates. So I hope that answers the question, but we definitely need to encourage more people to be comfortable performing CPR, be comfortable using an AED. You know, one of the things we talk about here at the FibTech is, you know, keep calm and turn the AED on. That's the only thing you have to know what to do. You don't have to have any specific training. You just hit the green button or lift the lid. And as soon as you do that, the AED is going to talk to you and it's going to give you step-by-step instructions telling you exactly what to do.
Well, as far as the online community that I was describing, it will be inclusive of lay rescuers. So I'm not sure if that's what the question was directed to, but it will be for not just survivors and their family and friends, but also for lay rescuers and EMS professionals who are interested. So I don't know if that helps.
Okay, cool. And this one was in reference to one of your points, Mary, about having an AED at home. And the question was, do you recommend AED placement in homes for anyone or specifically for people with heart disease?
The thing about sudden cardiac arrest is that it's sudden. So you may not realize that you're, you know, have any kind of underlying condition. I mean, personally, I do recommend it in homes in general, but I think some people would not feel comfortable with that for various reasons. There's been a fair amount of research that's been done about AEDs in the home that show that people are maybe reluctant to use them or afraid of them. But that research was actually done years ago, and now the devices are a lot easier to use. So me personally, I do recommend it and have recommended to family and friends that they should have an AED. So
definitely. I agree. I mean, obviously being a survivor, it's pretty easy for me to say. But you know, we've heard stories of people that have one in their car and they're in a situation where sudden cardiac arrest happens and every second makes a difference. So like you said, Mary, it's sudden. And a lot of times, you know, there's people that have undiagnosed heart disease. You know, statistically, they say 1 in 300 young people are living with a heart disease that's undiagnosed. So they might not be displaying signs or symptoms or anything. And unfortunately, the first symptom a lot of times is sudden cardiac arrest. And we don't want it to be too late, right? We want to make sure that, you know, we're prepared for that situation when it is a person's first symptom, that we can get that AED on them as quickly as possible.
And to follow up on that, Mike, too, I think I didn't point it out in the slides, but the incidence of cardiac arrest among young people is estimated to be 23,000 cases a year. So the more that research is being done, the more we've learned that past figures that have been cited are just not accurate. It's really more frequent with young people than we had realized before.
Mm-hmm. We had a question come through about encouraging, working to have employees in stores or in big corporations, encouraging them to do CPR and not being afraid to do it because of liability, which is a great question, and I think it's something that we definitely want to talk about a lot because unfortunately, when an emergency happens for a bystander, not a medical professional, someone that's not a nurse, not a doctor, not an EMS professional, if they witness a sudden cardiac arrest emergency, it's could be the only time in their life that this happens. And we want to make sure that this person is as confident and comfortable as possible stepping up and doing whatever they can possibly do. And one of the things we work to do here at the FibTech is encourage people to understand that when someone is in sudden cardiac arrest, unfortunately, they can't get worse. So by providing chest compressions, again, by turning an AED on and putting the pads on, you are doing everything you can. You cannot make that person worse. And trying to instill confidence in people that you can help save somebody's life by doing everything that you're capable and comfortable doing, again, before that ambulance arrives. And making sure that people understand that every state does have a Good Samaritan law, which protects someone who attempts to save a life. So, that's definitely something that we encourage and something that we're trying to spread with our awareness.
Yeah, you can't make the person any worse off by using the AED. If they're already dead, you can only help.
Yeah. I was actually at a presentation with someone, with the director of EMS last week, and they said it as clear as you can possibly say. You can't make someone dead more dead. So, whatever you can do as a bystander to help step up and help can only do exactly that. It can only help the person. Question about the price of AEDs getting to the point that they will be more common in homes. It's definitely on the radar. It's definitely something that's being talked about. And it's definitely a goal of trying to get these more accessible and in the future have them be in more homes. Couple more. We have time for a couple more. So good. And this was a question that I kind of answered before, and just to kind of clarify. So unfortunately, we know the survival rate for sudden cardiac arrest is low. And one of the things that I think is really important is making sure that we can highlight that the saves that do happen, and we can show that bystanders, when they do help save a life, it's important to acknowledge those people, and because what it does is it acknowledges someone to help save a life, but almost more importantly, it just raises the awareness that a lay rescuer can step up and help save a life. And the more people that are aware of that, I think the more people that we will make more comfortable stepping up in a situation where they need to perform CPR. And that is pretty much it. So that was great questions. I appreciate everybody taking the time to ask. I think Mary has some great insight on sudden cardiac arrest and what the work they're doing, and it aligns right along with the FibTech and everything that we're doing. So just to close out, just a couple of reminders for people. So we will be again, we're recording this. We will have it up on our YouTube channel. We will be sending out that link. So if you want to share this with anybody that might be interested that wasn't able to make it today, you certainly can. We will also attach the slide deck. Like I said, you can always reach out to me, mpapale@thefibtech.com, and I would be happy to send the deck directly to you if you need it sooner rather than later. We can get it to you right away. So just want to Mary, thank you so much for taking the time today to be with us. Sure. And for all the great work that you're doing.
Thank you.
Yeah, it was definitely very very informative. So I appreciate your expertise. And again, thank you everybody for joining, and we hope you enjoy the rest of your day.